Well, I know that you and I have actually have a difference of opinion over the healthcare bill, in that you think that even if it does come down to passing something over nothing, you think something is better than nothing. And my feeling is that if it comes down to nothing but a wealth transfer to the insurance industry, that you're only going to empower them further by handing over $1 trillion in order to be able to continue to pervert the healthcare system in the country.
You can have a less than zero story, and we may end up there, in which case nothing would be. I mean, because if you're mandating insurance and you don't have effective regulation, which I don't know that they will, because keep in mind most of the regulations.
Because it's worked out so well for the banks.
Yeah. Well, and most of the regulations at the state level. So how good, so even if we have some states.
Oh, and they're going to wipe that out too, right? Yeah. NZ amendment?
So
it just tends to be worse at the state level than the federal level.
Oh, okay.
That's
easier to buy a state government.
Yeah, so
yes.
I mean, I shouldn't pick on Alabama because I don't know, but my guess is that the insurance regulation in Alabama is not very good.
No offense, Alabama.
For consumers. So
if you guys are some weird Southern model for consumer rights.
So no, you could end up less than zero, and this is something that I would say it's bad policy, and it's also probably going to be really bad politics because people are going to resent this. What they see is that they're being forced to pay for an insurance policy that doesn't give them anything.
Right. Well, a couple of things. One, 1994 was a bad election year. They seemed to be very afraid of it, but NAFTA passed right before the election, and liberals were demoralized, the people that they count on to show up in midterm elections, which doesn't seem like the absolute best idea. But two, there is a problem in the healthcare industry right now that they are going to have to deal with, and if you can keep a truly terrible bill from passing, in the hope that they will have to address it in some other way, you don't think that's realistic?
No, I mean I have to say, if the scenario of them passing nothing, I think in all probability we will get like next to nothing. I mean, you could always say you get a little S-chip expansion, something like that, which is a good thing, but it's not.
Or Medicare. I've heard them talk about Medicare expansion to like lowering the age limit on Medicare.
I don't think that's a likely one. That's really expensive.
Yeah.
It's really, really expensive. So, I mean, if you got a Medicare buy-in, that'd be fantastic, but that's actually a very progressive policy, and so there are things you could do that wouldn't in principle be all that hard, but I don't see anyone going near any of those things for, probably if we're lucky, say a second term of the Obama administration, which requires there being a second term of the Obama administration, and even then I wouldn't necessarily bet on that. So I'm not looking forward to it going down, but I would certainly say, you could have packages, and it's certainly very possible at this point, where it would be better it went down. If you're mandating people get insurance and you don't have any reason to believe that that's going to be good insurance, that's the one plus that I think people should be really clear on. It's a huge plus. Most of us aren't insured. It doesn't matter that we have insurance. We're not really insured, because if we get sick, we're going to lose our jobs, and then we're going to lose our insurance. So we're really not insured, and that's the reality, and everyone should know that. So it's not 47 million that's uninsured. It's probably something like 147 million who, if they got a serious illness, they're not going to be insured. So if you had the elimination of discrimination based on pre-existing condition and mandatory issuance, that's a really, really big thing. So if we got that, that's a really big thing. But offsetting it on the negative, as I say, if you're requiring everyone to give money to the insurance industry that they might literally not be getting anything for, you have a high deductible policy that, you're a healthy person, you occasionally have some expense, but, it doesn't get covered because it's a high deductible policy. That's a hard one to sell.
But you've also got an entire class of people who probably are being forced to buy insurance that they can't afford to use. It doesn't cover, a high percentage of your medical expenses. Having been through usual, reasonable and customary medical charges, and wound up with being fully insured with a $65,000 bill for my last bout of cancer, like, people get wiped out anyway, and what we're proposing that they have to buy into is something that they still can't afford to use.
That's, again, a lot depends on what you end up with the subsidies, and then it also comes down to the regulation, because obviously the insurance companies, that's of course the big game. Every claim they don't pay is more profit for them. Now, if you had serious regulation, they don't get away with that. But
there's no regulatory board.
That's right. That's what I'm saying.
How any of the bills, I don't believe.
How confident are we going to be that they will actually be required to pay the claims that they're supposed to pay? And I'm not hugely confident of that.
So some influential liberal economists have downplayed the impact of war spending on our economic crisis. Why is this? What is the actual impact of war spending on our real economy?
Well, I don't think it's actually that huge. I hope I don't get accused of that also. I mean,
I just read them.
Yeah. I mean, Dean just the two wars, it's a little over 1% of GDP. Obviously, there's other expenses that are not included, a lot more that's not included in that. But it isn't, people that are hoping that the war spending is going to become unaffordable, or that it's, what's total military spending now, right? It's 4.5%.
4% of GDP.
Yeah, I mean, we had 10, 15% in the 60s. Obviously much more than that in World War II, but it's, that's not an argument that we should do this, but I don't think the economic arguments that this leads to disaster are very strong. It leads to disaster in other countries. It leads to disaster for the thousands of soldiers who are either killed, wounded, come back with post-traumatic stress disorder, and all kinds of other things. I mean, it's a horrible human cost, but the economic costs are not going to help us very much putting an end to it.
I think it's important that we, progressives understand clearly what they are, because, if you exaggerate it, I mean, you always exaggerate a little, but the point is, if you say things that are silly, it's easily dismissed, and it is a cost, and it's important to be put in some context. And we did a paper here a few years ago where we commissioned Global Insights. We got them because they're very centrist, very established, and, they're widely said on these things. So we had them use their model to show the economic impact of the Iraq War. We said an increase in military spending, roughly what we'd spent on the Iraq War, 1% GDP, sustained over a long period of time. And I knew what it would show. It shows that there's a loss of jobs, a loss in output. It doesn't lead to a collapse, but I think after 10 years you had somewhere around 600,000 fewer jobs than if you hadn't done the spending. And GDP's down by half or 3/4 of a percentage point, so you lose somewhere in the order of let's say 80 billion a year in output. It's not a disaster, but it does have a negative economic impact, and people should understand that. And also, part of my reason for doing this was we get into these arguments over environmental measures where, again, I know what the models will show, because they can't show anything but that you're interfering with the market. So it's going to give you a worse outcome. I mean, you don't even have to run the model. I mean, you have to run the model, find the exact number, but the fact that it'll give you a worse outcome, it has to. That's almost by definition. So, part of my rationale in doing that was saying, okay, you run these models and you show that if we want to have a carbon tax, that's going to cost 300,000 jobs, 500,000 jobs, and then you have all these people running around D.C. like chicken with their heads cut off. What could possibly do that? You go, well, you just had a war with Iraq. You never even talk about it. So it's at the very least. I mean, one of the things I like to say is, we could lose any argument once, but we shouldn't lose it twice. So if it's intolerable to lose that many jobs because we want to protect the planet, well, then how can you lose even more jobs from a war in Iraq and not even discuss it?
With banks that are too big to fail and healthcare system that's out of control, is the broader question: is capitalism sick?
You can take that one.
Oh, okay.
You get the easy ones.
Well, yeah, I mean, it's pretty, I mean, I think everybody would, what do you call it, Great Recession? That's certainly a sickness, no? I mean, I think that's what they're asking, So I think we are at a time where we need some serious reform. And we're obviously, as you know, not getting them. So what's going to happen? And I guess, a lot of people think that they have kind of a catastrophism, that you see that a lot in the left, the right, and a lot of people even in the middle. You find that they think that, if these things don't get fixed, some disaster is going to happen, they're going to have to fix it, And I don't see that. I mean, the United States is a rich country, and it's going to be a rich country. for the foreseeable future, I can imagine scenarios in which it wouldn't, but they would mostly involve things that are really low probability events like nuclear war. And so, there's a lot, I believe there's a lot, obviously, like look at our healthcare spending. Okay, we can say that's unsustainable, and it's true. If you go out 30, 50 years, it's not going to happen. This path that it's on is not going to happen. We're not going to spend 35% of our GDP on healthcare. But we could spend quite a bit more than now before anything happens. So I think that's what people have to understand. Because right now, you see a lot of this stuff. Simon Johnson, I think, even subscribes to that. The idea that, okay, if we don't fix the things we're talking about, we're going to get a worse disaster and a worse disaster, and we're going to end up with the federal government basically imploding under a mountain of debt. That's not going to happen. And so really, it is up to us. We have to have the reforms. Things can get a lot worse. I mean, this country can become more and more like Latin American countries, The ratio of the top 10 to the bottom 10% here is about, 15 or 16 to 1. It used to be maybe 12, So it's gotten much more unequal by that measure and much worse by other measures. You saw what, the latest data from Piketty and Sias, where they looked at the last business cycle expansion, 5 years, 2002 to 2007. The top 1% got 65% of the income gains. I mean, pretty outrageous, Ought to have people in the streets for that. But that can go on for quite a while before we get to anywhere near the inequality that you have in Brazil, okay, or the mass poverty that you have, which we're not going to have because, we're not going to have anything like that because, it's a rich country. So I guess I'm only making this point not to say that, things are going to be all right. They're not. They can get worse, and they get worse for years and years. And the only thing that can stop it is really an actual active citizenry. I mean, people actually getting out there and forcing their members of Congress to vote for the reforms, that kind of stuff that you try and do, right? And that's what we're going to need. It isn't going to just collapse and then we'll be ready for the reform. Look at how close. Look at how bad it is right now. I mean, this is the worst since the Great Depression, and yet a year after the collapse, we have no serious reform of the financial system on the table. We don't have our health care reform. We don't even know we're sitting here arguing about whether what we get is going to be worse or better than what we have. I mean, we don't have the union reform, labor law reform, card check, the Employee Free Choice Act doesn't look good for that. So here it is. I mean, it's true. It's not the Great Depression, so it's not really comparable to the Great Depression in the sense of a political and economic crisis. But it's the worst thing we've had since then, and yet we still haven't gotten much in the way of reform. And what is it? This doesn't make me pessimistic. I'm actually optimistic. Okay, I believe. It doesn't sound optimistic, but we are going to get these reforms. But more and more people have to, care enough to do something, and they have to be informed, and they have to go over the heads of the media, and of course the established political leaders. That's where people are going to have to run in elections more. We don't have candidates that are. I'm not talking about radical candidates. I'm talking about candidates who will just stand firm for the kind of basic reforms that 60 or 70% of the people already agree with. We don't have that.
Well, also not not accepting the definition. So like working with Ron Paul's people, because that's what we have to do. There's a lot of people out there, again, might agree with them on almost nothing, but they want to see the banks reined in. So we want to see the banks reined in. So we got to work with them.
Well, when I was talking about them having to do something about healthcare, it's not because people are getting sicker and sicker or it's getting more and more expensive. It's because the medical industrial complex itself is finding itself in an untenable position where it can't function because people either can't afford healthcare, they can't pay their bills once they get it, they have to go into bankruptcy.
And what does it bother the medical industrial complex?
Because they want more people in the system, and if
profits look pretty good.
If it causes fewer and fewer people to be in the system, they're going to put pressure. The point is that I went into markup for some of the House bills, and it's like being on the in the floor of the Chicago Board of Trade these days. Like these lobbyists are paying like companies to hire homeless people to sleep in the streets, $3,500 a piece to get the seats in markup. And they're literally like screaming into cell phones and, telling, who voted on what for what amendment. And you can see like people, the Blackberries, people are, assistants getting notes and bringing them out to the Congress people. And I walked into the wrong room at one point, and it literally was a smoke-filled room with like green leather chairs that all the Congress members were sitting in. I mean, this is where people go for their profits these days. They go to Congress, and it's a matter of getting legislation that benefits you, big business. I know it's not new, but really they have turned it into like a fine.
Oh no, they're ripping off left and right. I just don't see why that means they'll have to change anything. But that point. I mean, again, this is something I grew up in Chicago. We both grew up in Chicago with the Daily Machine. So we're used to government not being the democratic ideal. But what really drove this home for me is somewhere in the late 80s.
I think it was more democratic than in a way.
It probably was.
Precinct captain.
Yeah, no, it was responsive.
It wasn't all just raising money in campaign commercials, right?
Yeah.
You had to talk to people and give them something.
But there was, I believe it was a Moyers special, Who Will Tell the People? I think it was based on a book by Grider. And it had, and I'm forgetting exactly who was the journalist there, but they were talking to some DC insider, and the guy, they're amazed at the corruption around the SNL scandal, and they're talking about, how come Congress isn't doing something. So the guy goes, well, why do you think people sit on the banking committee? The guy goes, well, they oversee the bank. He goes, people sit on the banking committee to get campaign contributions from bankers. And, in a certain sense, that's really obvious. You really, if you don't think of things that way, you don't understand Washington. The committee structure is a menu. So if you're going to sit on the banking committee, you get money from bankers. If you're going to sit on the defense committee, you get money from defense contractors. It's, you get a menu. Who are you going to get your campaign contributions from? Their job is to get reelected. Incidentally, some of them might be decent people who have this or that agenda. But first and foremost, their job is to get reelected. And if you don't understand that, you're in the wrong town.
And so, ergo is capitalism sick?
It's not doing real well.
It's got a flavor for sure.
The fundamental problem here is that
it's got swine flu.
Profit is considered to be the ultimate good, right? When we're discussing these things like auto industry bailouts and
I don't think it's. I think you give it too much credit if you say it's ideology, though. They're just getting paid. So I don't think it's that any of them think that profit. They don't think that much. It's just like, okay, what do I have to do to get your support in the next election?
No, like the conversation during the auto bailout, during the hearings, was how can we make GM and Ford, quote unquote, profitable? Profitable in that completely false sense of what falls to the bottom line, not like what is the ultimate cost to society, or how much do we have to pay to, maintain an oil economy and healthcare costs because of pollution. I mean, there's, we're talking about how do they become fundamentally, financially sound.
Yeah, I think it was more just who do we have to cover. So, for example, if the unions were in a stronger situation, then I don't think it would have been any problem to make sure that, say, that they had the health care benefits that they'd worked for 30 years honored. And it was kind of incredible that, it happened over the same weekend that they forced, I forget which specific, it must have been General Motors, that they forced the workers to give up their health care benefits, or at least take a much weaker commitment, at the very same time that we had Larry Summers go out there talking about the sanctity of contract with reference to the AIG bonuses.
That was a good moment, wasn't it?
It's just incredible. It's just incredible. And I don't know if
and that's another thing they invoke on the home foreclosures too, right? If you want to have the right to rent that you're talking about, that's a violation of the sanctity of contract.
Yeah.
But that was the start of the teabagger movement, wasn't it? It was, what's his name, Rick Santelli, on the floor of the Chicago Board of Trade, calling everybody deadbeats because they wanted
to not pay off their mortgages. Yeah. But it's just amazingly selective how they do this. So, here it is. It's not even, because there's two issues. One is the union contract going forward. What's your pay? You're supposed to get, $25 an hour, and they say, oh, we can't afford that. That's one argument. But when you've already worked for it, you worked for 30 years for your health benefits, how is that any less sacred a contract than the AIG bonus, which by the way, is a bankrupt company, and you know a lot of these people were at least partly responsible for making them bankrupt. It's just amazing. Or take another example. A couple years ago, I guess about 4 years ago now, they passed the bankruptcy reform law, which made it harder for people to have their debt burdens relieved in bankruptcy. They applied that retroactively. So where was the sanctity of contract there? You had people incurred debt under one set of bankruptcy rules, then they turn around and give them a much harsher set of bankruptcy rules. They could have, if you wanted to do it, I probably still would have been opposed to it, but you could have said, okay, if you go forward, after, the day after we pass this, then the new bankruptcy laws apply. But no one even gave a damn. They just said, no, we're going to apply it retroactively.